One of the things I think about the research that we're doing is it's incredibly exciting. I find a lot of the research that's in the literature in clinical research often is incremental studies, making small changes to existing therapies. And I think the research that we're doing in the lab really focuses on conditions that have extremely high, unacceptably high mortality rates, and are currently serviced by treatments that are inadequate to address the issues. And so one of the focuses for us is really focusing on research that's going to be, rather than making small changes, are going to take a next big step, where we may see a paradigm shift in the way we treat the patients, and ultimately a paradigm shift in improved survival and outcomes for the patients and families with the conditions. Congenital diaphragmatic hernia is a defect in the diaphragm that forms in babies in utero, where it's really a failure of formation of the diaphragm, so that the abdominal viscera or abdominal organs herniate up into the thoracic cavity, and as a result makes their postnatal course quite rocky in terms of inhibiting lung development, and as a result they develop severe pulmonary hypertension. Based on some of my prior work, I'm able to identify an enzyme-linked pathway that seems to be important in the progression of the pulmonary vascular disease associated with the hernia. And now we're at the point where we can start targeting some of the members of that pathway to see whether we can stop the progression and potentially reverse the disease process. At CHEO, we really focus on the patients. It's a very patient-centered delivery of care, and as a result, that translates completely into the research that's ongoing to maintain a very patient-centered approach. And so we really want to focus on the things that really we feel are going to make the most difference for the patients, and hopefully in as timely a fashion as possible.